Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, thank you for joining me on tonight's Egg Whisperer Show. I'm Dr. Amy, your host of tonight's show, and the topic is what you wish you knew before starting your fertility journey. And maybe it's a little bit of what I wish I could teach you before you started your fertility journey. So I put a call out a few weeks ago on social media, and I asked people to send in their what they wish they knew first. And then I got a whole bunch of responses, and that's basically what I'm going to talk about today. So here we go. So what a lot of people wish they knew is that their fallopian tubes were open before even they started treatment, before they started trying to get pregnant. They wish someone told them that, for example, one exposure to a sexually transmitted infection like chlamydia could block their tubes, or having a myomectomy, or having an ovary removed, or endometriosis surgery could affect fallopian tubes. So that's what I'm going to tell you tonight. That having surgery in your abdomen or pelvis, even an infected appendix, can cause something called tubal scarring or blockage. An egg and sperm meet in the fallopian tube, and that little embryo will travel down the tube, land in the uterus before it sticks and grows. So fertilization occurs in the tubes. If your tubes aren't open, it's going to be almost impossible to get pregnant at home. And ovulation is like a flip of a coin. You can ovulate on one side every single month for a year before you alternate and ovulate on the other side. So it isn't like one of those things where you ovulate from the right side on the odd months and the left side on the even months. If only it were that simple. So what I wish patients knew is that your fallopian tubes are an important part of conceiving, but at the same time, you don't need to have tubes to get pregnant with IVF. The next thing is a lot of patients wish that someone had done a pelvic ultrasound before they started trying to conceive. We spend so much time in doctors' offices from the time that we're young, as early as 18 or 21, doing things called annual exams where people are doing pelvic exams on us, pap smears on us, and a simple pelvic ultrasound could shed light on something like if there's a fibroid or a polyp inside the uterus. My fingers don't have cameras on the end, but certainly a pelvic ultrasound probe, what I call Wanda in my office, my pelvic ultrasound wand can guide me in a way that my fingers can't. I can't feel if there's a polyp within the walls of the uterus. But a uterine ultrasound, before you try and conceive, that makes perfect sense to me. Because my patients who come in with a fibroid sitting smack dab in the middle, after trying for 1 year, 2 years, they really wish that someone had told them to get a pelvic ultrasound, please. And if you're having symptoms of endometriosis, studies show that it can take someone years and years to get an accurate diagnosis for this disease. And oftentimes people are ignored, and a simple pelvic ultrasound is never done for diagnosis. So ask more questions and ask your provider for a simple ultrasound at an imaging center, at a local hospital, with a fertility doctor, because we're here to guide you and help you and tell you what your diagnosis is before treatment and hopefully prevent the tears that so many of my patients have shed for years. Sperm health, holy smokes, as if it were all our fault. And when I mean our, I mean the egg's fault or a woman's fault. A third of fertility problems are egg-related, a third are sperm-related, a third, it's related to factors on both sides. A semen analysis is such a simple test. And people are told that the diagnosis of infertility is if you're trying for 1 year of conceiving, then you should get help. But in my world, my thing is this. Listen, guys, we're waiting longer to get pregnant and have babies. In the Bay Area, people are seeing me at over 39, ready to start their family. I don't want them to wait 6 months, 3 months, even 1 month before getting their fertility health checked, let alone 1 year. So doing a semen analysis is a really simple test. Women are used to getting poked and probed, taking a look at the swimmers and seeing how fast they are, how well shaped they are. That's really helpful because you hear me say it takes two to tango. Well, certainly it takes a healthy sperm cell to turn into a healthy pregnancy as well. And without a semen analysis, you won't know what your chances are of getting pregnant at home. You won't know what you can do to improve your sperm quality as well. And there are really cool tests out there that look at the DNA of the sperm and can help guide you even better before you start your treatment decisions. Now there's hormones. I have patients that tell me, I wish I knew I had a thyroid problem. Or they say, I wish I knew my AMH sooner or earlier. Or why didn't anyone check my FSH? I haven't had periods for years and they just told me I had PCOS. A simple hormone test could have told me that I actually have been running out of eggs this whole time. I hear these stories day in and day out. And that's why I put all these letters together, and I have one more letter to go through before I tell you what this concept is. And lastly, it's the genetic profile, or your genetic profile. I have patients that say, I wish someone had done a carrier screen on me and my husband before we had a baby with cystic fibrosis. And that breaks my heart, because I want to make sure that people know that these tests are out there. And so that's why I do shows like this. So if you're listening, you know what to ask for. A carrier screen is a simple blood test that can be done pre-conception. It can also be done in pregnancy. Right now, these tests seem to look at around 300 genes or so, and if you're a carrier, which is super, super common, it doesn't mean you have a disease or you're going to get a disease or it's going to affect your quality of life. But if your partner is tested and also positive, it means that there might be about a 25% chance that your baby could have that disease. So finding this out pre-pregnancy will give you the information you need to decide if you want to do something like test the embryos for that disease. But even if you don't want to do that, at least you'll be prepared in pregnancy for what your options are if you end up with a child with that disease. So it doesn't mean you have to end a pregnancy. It doesn't mean that you're playing God. You know the saying, knowledge is power, and truly knowing your genetics is truly powerful. And not just about your carrier status, but when you're a patient of mine, I talk about things like cancer genes and reproductive genes as well. So this all spells that one term that you hear me say all the time, and that's Tushy method. And get your Tushy checked, because honestly, if you get your Tushy checked, you'll look back and say, I have less regret, because I knew all those things in the beginning, from the beginning. And if you've had your Tushy checked and people are still using terms like unexplained infertility, you know what? Let me explain it to you. I can certainly guide you, because I have patients that say to me, hey, Dr. Amy, I'm 41 years old and I've been told I have unexplained infertility. And then I'll break it down for them and I'll say, you know, you just gave me the diagnosis. You're 41 years old. You're certainly awesome. You're meant to be a parent, but let's talk about what being 41 years old really means and how I can help prepare you for a pregnancy and what your levels truly mean given your age. Because our age is more predictive of pregnancy than any level when you're over the age of 40. And I think also that people think that their levels can potentially mean something that they don't really mean. I have patients that say, Dr. Amy, I checked my FSH level and it came back at 5, and my doctor said that I had the ovaries of a 25-year-old. And then I have to point out, hey, look, you know, you didn't have your AMH level checked, and they didn't check your estradiol level. So you can't just look at an FSH level alone to find out if you have a chance at pregnancy or not. So truly getting a complete hormone panel is so important. And you can get your Tushy checked in just one cycle. Your period starts, you go in for blood work around cycle day 3. You can have all the hormones checked, your carrier screen done, and then you call the imaging center and get your tubes checked. Your partner is getting a semen analysis. You get the carrier screen done as well. By the end of the cycle, you have all the information. You have time to start vitamins like vitamin D supplements if you need to, a thyroid supplement if you need to. You make an appointment with your doctor at the end of that cycle to review all the results, and then you come up with a treatment plan. I make it sound really easy. It's really a lot of work, just like IVF. I mean, IVF is very frustrating at times, but I think of it as it's very fun in my world, and I truly try to guide patients in a way that they know everything about themselves before they do it. And don't get me wrong, I have patients that ask me, hey, Dr. Amy, you know, we want to do IVF. I don't understand why you're doing these tests on me. And I point out and say, you know, knowing if your fallopian tubes are open is still really important to me, because I've had patients that have said to me, Dr. Amy, I had an ectopic pregnancy with my first embryo transfer, and I wish someone had checked my fallopian tubes. So I don't want that experience with my patients, especially when they're over a certain age, and each embryo is so every embryo is certainly valuable, but we work so hard to even have that one embryo that you want to make sure if you're putting in the uterus that it's staying there and that you're not at risk for something like an ectopic pregnancy. So without doing these tests, you wouldn't know. So what you wish you knew before your fertility journey, you know, could be learned ahead of time. So here are some of the things that patient reached out to me with. Someone said to me, I wish I had tested my hormones and done a consult with you before I tried home inseminations. What a waste of money when I didn't even know how my own ovulation worked. I wish I had done everything you and the acupuncture suggested from day 1 with exercise, nutrition, stress to get my body in top form. So I want to go back to that first thing that she said. She said, I wish I tested my hormones and did a consult with you before I tried home inseminations. So this is a woman who's a mom by destiny, also known as a single mom by choice. I hear that all the time, but most moms are just moms by destiny. I don't like the word single because no one is ever really alone. And my patients who come to me ready to be moms without partners, they certainly have their tribe and they don't feel lonely when they make this wonderful decision for themselves. They feel energized and super excited to be parents. So this one patient, she was doing home inseminations without really knowing more about her ovulation and when exactly to do them. And sperm is really expensive. One vial of sperm can cost anywhere from $400 to even $800 depending on the sperm bank that you're using. So just think of the Tushy method, getting your Tushy checked first. The cost of that is about half of that. And so if you had spent, some money, let's say doing more of the diagnostic testing, perhaps you would have saved more money down the road. So that's my messaging to people, that getting the diagnosis before treatment is, while it seems daunting, it's a lot of work and it's not cheap if your insurance doesn't cover it. I added up all the elements and it's around $2,000 or less. That is a lot of money. But think about a fertility treatment or the frustration of going through a year of trying, or even an IVF cycle that doesn't work. The amount of energy that you're putting into the diagnosis can potentially help you even get pregnant at home. And that's what I try and equip my patients with. And that's a plan for getting pregnant at home, so that even if that isn't a plan that works, at least we've worked on all the elements before we move forward with a very expensive and time-consuming treatment. So as far as a waste of money when I didn't even know how my own ovulation worked, well, that's really important. Not everyone ovulates on cycle day number 14, and a lot of people don't understand exactly when they ovulate. And there are very simple tests that you can do, ovulation predictor kits. There's a progesterone test that you can do now after ovulation called the PROOV test, PROOV. So these tools can be done at home, and then certainly you can go to a fertility doctor like me and just kind of confirm if you really are ovulating. And if you want to do a home insemination, you can still do that with the help of a fertility doctor. But for the most part, with a fertility doctor's help, if you want to be as natural as possible, we can do an LH or Opk Timed Insemination in the office. So what that means is, for me and my patients, I ask patients, hey, when do you think you usually ovulate in your cycle? And then I ask them to start tracking ovulation maybe a couple days before with an OPK, and then I have them come in if it's positive before that day that they indicate to me. They come in for an ultrasound, I look at the ovaries, and based on the size of the follicles, I might even give a trigger shot to induce ovulation at a time when I think the sperm and egg are most likely to meet. And then we do the IUI in the office, where I place a speculum in the vagina, I take a catheter, insert it through the cervix to the top of the uterus, and insert the sperm and hope for the very, very best. And so this is one approach that you can take among so many others. So along the lines of exercise, nutrition, and stress to get my body in top form, that is so important. But I don't want patients to delay trying to get pregnant because they feel like they need to be at a certain body size or weight. You hear me say often, your fertility is not skin deep. And it really applies to also women who are in great shape. Just because you're in great shape doesn't necessarily mean that your eggs are in great shape too. Putting Botox in your forehead, for example, might work, but it doesn't really work for our ovaries, and I certainly wish that it did. So making sure to get your levels checked, being really honest with yourself about your age and what your chances are and what you're willing to do to have a pregnancy is super important. So here's another person who reached out to me, and I'll start reading what they said about what they wish they knew before their fertility journey. So this is a really important thing for us to learn from. I think one thing that I wished I would have known before starting my fertility journey was what to do with my remaining embryos and my feelings about them. I sometimes struggle knowing there are 2 male embryos left, and I'm sad for them. I know that they're there for me if we decide to have more children, but that's not in our plan right now. I know there's embryo adoption, but that's not something we want. And then there's destroying the embryos. My husband and I aren't very religious. He grew up Christian and I was raised in a Buddhist household. Neither of us want to destroy the embryos, but we are also not sure we want more children. Before I started IVF, I should have thought about how I would feel if I were to have unused embryos. I'm going to read that last sentence again. Before I started IVF, I should have thought about how I would feel if I were to have unused embryos. You know, it's a really hard thing to think about. And the reason is when you don't even have a single embryo, you're not even thinking about having extra embryos, because I can tell you, I talk to my patients and I say, what's the family size that you want? And they say to me, Dr. Amy, I'd be so lucky to have just one baby. And I say, I know that, but I want to help you reach your family size goals. And the way we do that is we fertilize more eggs to get a certain number of embryos, and sometimes that does result in extra embryos. So this is a good time to think about your fertility team before you start IVF. And the T in team stands for a fertility therapist, someone to talk about. You and your partner should sit down and talk to someone about how would you feel if you had unused embryos, and make sure that you're on the same page. Certainly this couple sounds like they're on the same page. They both aren't sure what they want to do. But what if you're not on the same page? And that would be really hard. What if you end up splitting up? And how would you resolve the issues around that? So talking to not only a therapist, but maybe someone that's a family attorney as well. I certainly don't want patients to split up and then have to deal with fighting over embryos. But talking through these issues before IVF is so important, because depending on how you feel, you might do something differently. There is egg freezing as an option. You can freeze a certain number of eggs, fertilize the rest, but realize that egg freezing may not be as good as using fresh eggs in a particular situation. For example, if the sperm quality is really poor, it might be better to use a fresh egg than a frozen egg. And embryos are just a known entity. So if you end up, let's say, with one embryo and you still want more children, potentially, you may end up having to use your frozen eggs. So thinking about all those things, super important to do with your doctor, with a therapist. And then, as you're looking at the consent forms, really consider them as legal consent forms, and making sure you know exactly what each of you is going to do if, let's say, something happens with a relationship, something happens to one of you. Always think about those things up front and first. But it's so hard to. I totally get that, because you just want a baby and start a family, and you're not thinking about the future necessarily. You're just thinking about the here and now. So here is another what I wish I knew from someone. I wish I knew that we had fertility issues from the beginning of the journey. I hear this so much, and I think that people think that they have to literally try for 6 months, and then they go to their OB-GYN, and the OB-GYN says, no, you need to try for, and not every OB-GYN does this, mind you. Oh, you have to try for another 6 months, and then I'll check levels on you. Look, guys, you can get your levels checked at any time. I started a website, eggwhisperer.com. That was out of my egg freezing parties, because I was teaching people about egg freezing because I just wanted to teach about fertility, not because I wanted to freeze everybody's eggs. I did that so that people would learn about the fertility process, so that I would see less 40-year-old women crying in my office saying, I wish I knew that I could have done an egg freeze. And so I want to tell you that you can get your levels checked. It doesn't matter how long you're trying. You can do it along the way. I want everyone to get their levels checked by the time they're 25 or even younger if they have a family member with a history of endometriosis or having fertility issues. And then, for example, if you're 32 years old and you want at least 2 kids, consider egg freezing or embryo freezing or both. And if you're 37 and already have 1 kid or so, at your postpartum visit, think about getting your levels checked again and talk to your doctor about doing an embryo freeze, because it's so much harder to get pregnant over the age of 37, and it's even more difficult to get pregnant over the age of 42. And then between 40 and 42, just a small percentage of women can actually get pregnant with their own eggs. And we hear so many celebrity stories. In fact, there was just this last week another celebrity story of someone getting pregnant at 47, and she talked about her pregnancy as a miracle. And certainly every pregnancy, to me, is a miracle and is very precious. But it's her business exactly how she, did achieve that pregnancy. And I consider that pregnancy natural and normal, and her pregnancy. But to be completely truthful and honest with the public, it would be really great for her to also say, or someone to come out and say, look, at 47, the chance of a pregnancy is about 1 in a million. It's extremely rare to have a healthy pregnancy with your own eggs. So I see a big uptick in my office every time a celebrity has a pregnancy like that, because people start thinking that technology has changed, or, I hear this quote, oh, I can wait till I'm 40. J-Lo didn't have her babies until she was 40. And certainly we don't know what J-Lo did to, or the treatment that she went through to have her kids. And it's honestly none of our business. But your fertility isn't like JLo's fertility, and it isn't like the 47-year-olds that just had IVF treatment and got pregnant. And certainly knowing if you had fertility issues from the very beginning can only be helpful. Here's another quote. I wish the doctors listened more because they always said that we are young, just wait. I feel so bad for all of my patients who come to me because I just want to literally heal their pain, fill their hearts, and help them achieve their goals as quickly as possible. But young people, they get these, people saying that to them like, oh, just wait, you're young, you're young. But in my humble opinion, a young person, we should be even more vigilant trying to help them. Start diagnosis soon. Check an AMH level. Do everything you can to help someone who's under the age of 30 who's having a difficult time. I mean, in the Bay Area, there aren't that many people trying for babies, in their early 20s. And so when I have someone in their early 20s reaching out to me saying they're having a hard time, I'm saying, come on in as soon as possible. Let's start testing. Let's see what's going on so that I can help you, because I can imagine the things that people are saying aren't really that helpful. Here's another quote. I wish I had known how hard the 2-week wait would be and better prepared for it. Yeah, that 2-week wait, that is really, really tough. In my office, I call it the 8-day wait. So after an IVF embryo transfer, we call it the 8-day wait, because I check for pregnancy 8 days post-transfer. And people say to me, hey, I thought it was a 2-week wait. Why are you only checking at 8 days? Are you sure you're gonna know? And I can tell you, yes, you are gonna know. 8 days post 5-day transfer, you are gonna know if you're pregnant or not. And I certainly wouldn't want my patients to wait another 6 days. That certainly feels like the longest wait ever. But there are a lot of tips and tricks that you can do along the way. Fill your time with activities. I tell patients to organize photos, drawers, reach out to friends and connect with people, talk to your therapist, really engage with your support system and support group, and do things that are fun and fill your life with joy every single day. Find things that make you feel joyful, whether it's music or concerts or, reading a book or poetry, and really use that time to do that and distract yourself, because that is a really, really tough wait. The waiting to find out how many eggs you gain. And what I mean by that is when I do IVF on patients, I always talk about gaining eggs and not losing them. I'll give you an example. So for example, let's say someone has 12 follicles and they have 6 eggs retrieved, and they'll say to me, Dr. Amy, where did all my other eggs go? I lost 6. And I say, no, you actually gained 6. So the other 6, they didn't have viable enough eggs to come out. So every cycle will have a certain number of eggs that are meant for us. And then let's say the next day we get 5 embryos. So I say, oh, I'm so excited that we got 5 embryos. That's what was meant for us in this batch. And they'll say to me, but I had 12 eggs, I lost 7. And I say, no, you actually gained 5. And then let's say 5 days later, we have 3 blastocysts. And I say, we have 3 blastocysts that you've never had. Look what we have now. We've gained 3 blastocysts. But human nature is a funny thing. We're kind of programmed to think about things that we've lost. It's just kind of how we're trained from a very young age, that 100% on a test means literally getting 100 things right. But when it comes to human biology and reproduction, 100% just means having one high quality healthy embryo that turns into a healthy pregnancy. And sometimes it takes 12 eggs to get 2 healthy embryos out, or it takes 12 eggs to get 1 healthy embryo out, or it takes 30 eggs to get 1 healthy embryo out. So changing how you think about things and your perspective can help, so that when you go in, you're coming out with the right set of expectations. Because certainly if your expectation was that you start with 6 eggs and you end up with 12, well, certainly you're going to feel really, really disappointed. But if, for example, you're one of my patients and I'm guiding you and you're over 40, I often will say, look, it might take several cycles for us to even get 1 healthy embryo, but I'm going to guide you every step along the way, and I'm going to tell you whether we should keep going or consider other options. I hope this information is really helping you guys. So here's another quote. I wish I had known how painful the shots are. Well, yes, the shots are a pain in the beep, they really are. So I have little tips and tricks that I teach patients. Sometimes patients just go too low in their butt. And I have my Sharpie pen that I draw on patients' butts with. And then I show that I have this little technique where, I do this little butt grabby thing. I almost caught myself saying another word where, I show the partner how to grab some butt. You just kind of jiggle, 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 jiggle. And so when you put the needle in, you just jiggle, 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 jiggle. So that distracts your partner so she's not trying to give you the look of death and try to stab you with the needle once you're done. And then you just go in super slowly and come out. And the other things that you can do, and what I'm talking about for those of you who don't know, is the progesterone and oil shot that so many patients do with IVF. So I tell my patients, look, here are my suggestions. You can warm the syringe first in a heating pad or just sit on it for a little bit. That warms it up. And then once you have the right needle on, you do the injection. And then when you come out, you can put a heating pad and do a little rub, rub, rub. And then if you look up magic wand, don't do that. Don't do it. Don't Google it, because you might see things that don't look really like the magic wand that I'm thinking of sharing with you. But there are some personal percussion, see what I'm saying, instruments. They're just like hand massagers, and you can just put on the area just for maybe 5-10 seconds, and that will also massage the area if you don't have someone that's signed up to massage your butt for you. Also known as a cabana boy in my clinic. So the next quote is that miracles can happen. I actually have so many specific things to list here, but I don't have time right now because I have 2 kids. So I thought that quote was a really special way to end tonight's show on what I wish I knew before my fertility journey. And this is a patient who's been through so much, and she sent this quote to me, and I thought it was pretty awesome that she wished from the beginning she knew that miracles can happen, and now that she's so busy that she doesn't even have time to send me all her what she wished she knew. But I have a feeling that I touched upon a lot of them here tonight. So you guys, don't forget to get your tushy checked. I'm going to keep talking about the tushy until every single person knows what that is. They know the simple tests, 5 tests that you can do to learn about your fertility diagnosis so that you can have a proper diagnosis before treatment. So you're not doing treatments blindly without knowing, for example, the tubes are blocked or the sperm is gone or the eggs are gone. Those are the things that I want you guys to do so you can live your best life. So be sure to subscribe to my podcast and catch my shows on YouTube. Subscribe there also. You can drop me a line at email@eggwhisperer.com, and soon we're going to be doing live call-in shows, and I really look forward to you guys calling in. Have a great night, and I'll talk to you guys next week. Good night.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Opk
And you have yet another success story.
Just launched by an East Bay fertility doctor.